is complex, but when you think about the simplest definition of mental health, it is impairment. It is some kind of impairment that is causing you psychological, emotional, some impairment in your life because of something that's not physical. So physical health, of course, is going to be just, your everyday sicknesses. It's a mental health issue. And when you think about how simple that is, you can see how so many things in society can really contribute to it. And when those things are compounded and not addressed, that's when you have Black men that have severe mental health issues.
Yeah. And with that, Antwan, with you being a psychotherapist, the rise that we've seen within Black men with depression and suicide, like just recently, we just lost Ian Alexander Jr. to suicide. In addition, Miss USA, we're hearing more and more stories about people in our community committing suicide because they've quietly battled depression. So why is it that now, do you believe the numbers are rising, or is it just because of social media, the numbers are being reported?
So I actually looked at some CDC data before our talk tonight. So the numbers are rising. Suicide in general is rising, but one of the interesting things that I saw in my consultation of that CDC research is that the persons that die by suicide in terms of males that are non-white or non-Hispanic white has decreased, but non-Hispanic Black has increased. So the amount of Black males that have died by suicide has increased. Now, when you look at that statistic, you got to think about a lot of things. You got to think about underreporting. People that have certain means can have certain influences over how their death is classified as whether it's accidental or non-accidental. So you got to take statistics like that with a grain of salt. But I think that the pandemic has really forced people, it slowed the world down. So the world was so busy, the hustle and bustle of everything. If you didn't matter, you did not matter, and nobody cared. With the pandemic, people had more time to really focus on anything because we didn't have a lot of other outlets to focus on. And it really highlighted a lot of things. And I think one of the things that it highlighted was Black mental health. So I think, it may have increased, but I think that more attention is now being brought to it. Like we now are at a point where Black lives do matter. That's not just a saying. That's just not something that we say in marches. It's an entire movement that companies and corporations have adopted. And all of this during the pandemic has caused even some social and economic disruption around Black Lives Matter. So I think that has really put to the forefront an issue that has always